So the next speaker, where is she? Here. Nathalie Largeron from Sanofi. As you know, to be fully transparent, our conflict of interest, we are supported by an unrestricted grant of 7 companies that are kindly allowing us to have this conversation 2 times per year. And we have always one of the companies presenting at this venue then, providing the joint industry perspective. It's my great pleasure to introduce Nathalie. She's a vice president at Sanofi for market access, or global head market access and health policy. Her background is pharmacy from University of Lyon in France, and then she went to what is today IQVIA, first in the Netherlands, and then moved for, I think, now almost 2 decades at Sanofi, increasing responsibilities, and was also heading the access franchise for the vaccine. So a broad view on the whole thing. Thanks, Nathalie, for joining.
So good afternoon. Very happy to be here with you today. So it's important indeed to listen to different perspectives. And now I will give the perspective of industry, and I will also share some of our learning in my company. Oh, no. So I think it's clear for everybody, but for us as an industry, it means a lot, this big regulation, so because it will have a significant impact in our internal ways of working. I think we have a lot of commonality. I am the last one for this afternoon, but I realize that finally we have a lot of similarity in some of our challenges, so that's quite interesting. But for us as a manufacturer, it's true that we are really concerned about evidence requirements, because it's true that we will have to perform probably more analyses, and we will have to start earlier. Also, very importantly, the interface with country, because this European dossier will have to be used at the end by our affiliate, who will have to do their own local HTA dossier, and also with different departments such as regulatory affairs and clinical development. So we are already working with them, but here the connection will be even more important. And the last point is about internal governance and processes, because finally we have new stakeholders at European level to deal with. And so it's true that we have to be compliant, we have to develop new procedures, and we have to also develop a very complex dossier. So we supported as an industry, of course, the adoption of the regulation, and we raised several concerns over the last few months. And we have to admit that our concerns remain today, a few months before the implementation. The first one, I think it has been raised several times about the system, which is not yet adequately resourced. The second one is really the lack of involvement as a manufacturer in the process. There have been some improvement, and we should acknowledge that. So we know that we will have now the opportunity to discuss about during the scoping process, but still no permitting, and still the involvement is quite limited. Yeah. Another important point, I think it has not been really discussed today, except at the beginning, because we heard something about the EU IT platform. We have not been consulted about this EU IT platform. It's not yet available. We know that a webinar will take place very soon, but there are some questions about sharing information with finally a big network. And so it's a lot of unknown for as a manufacturer. And we talk a lot about multiple PICOs, so I will not come back on that. On top of that, we are missing clarity on interpretation on certain provision, because now that we are getting close to the submission at the end, we are looking carefully again at the text. And there are really some important elements that we need clarity on this. For instance, what is the process of the dossier completeness check? Who will decide that our dossier is complete or not? If we provide a sophisticated answer to explain that we cannot answer all the PICO, will it be accepted or not? Another important question is about the public the transparency of the report. We are, of course, happy to have it transparent and to share that in the public domain, but it's not clear for us which part of the dossier. Will it be the entire dossier, including all the annexes? And you can realize how much analysis and data it's published. If you compare with EMA, they do not publish their entire reports. They published a good document, which is called EPA. And also the GCA submission dossier, we understand, should be also in the public domain. So we need clarity on that. And after, of course, the impact of the local HTA processes and timelines. So it shows that its uncertainty affects our company internal readiness. And I really realize that we had a lack of commonality because in terms of resource allocation, also we are asking ourselves, do we overcommit or not on some of the points? And also in terms of training, I think, because we train a lot our team and our colleagues at country level and in different departments, but at some point they ask us plenty of questions and we cannot answer this question. So we are a bit stuck, and yes, we do our best, but it's sure that it's not always easy to equip the team in real time. So that doesn't mean we do not do anything. So we do a lot to get prepared with all these uncertainties. And so here I wanted to refer to a survey that has been conducted before the summer and that has been released by colleagues from CIRS with different companies. And that say that most companies position themselves at that time as a midpoint of readiness scoring, which is not super high, not low, but everybody, of course, started to, most of the time they started to create task force and participated in a lot of conferences like this one to better understand the process. What we did in our company indeed is very soon after the publication of the regulation, we set up a task force that was quite small at the beginning, but to grow over time, and we had a very good framework and governance in place now to think about the different elements. And we need to be agile. That's our message, because this task force is quite agile, very flexible. We have new group coming. We can change the objective depending on what we learned. And yes, we need to prioritize also, because you can imagine it's a lot to get prepared. Also, as a company, we have been working a lot in different trade associations, such as, for instance, EFPA and Vaccine Europe. And so it was very useful to share our knowledge and to test some methods, to make some recommendations. So here I would like to point out and refer you to a few concrete deliverables that has been released recently. The first one is a paper that has been done to analyze, in fact, the impact of the scoping methodology based on 2 onco drugs, and to show the complexity of applying the methodology, in this case with a high number of PICO. The second one is a document that has been performed to really see the impact of this regulation in oncology and who developed some recommendations. And the last one is another paper published in Vanuatu Health, which is dedicated to vaccine, because it's something which is of interest also for some vaccine manufacturers. They are part of the regulation. It's not always mentioned because it comes to the end in 2030, but it's just important to remind that we talk a lot about oncology, but in fact, as I think it has been mentioned at the beginning, other therapeutic areas are really impacted. And so, yes, we always said it will be postponed, we will talk about that, but actually when? So I think this is very important to keep that in mind. So I encourage you to have a look at this 3 document, and I hope that can provide you some interesting insight. So in terms of readiness, it's true that now we can see different level of readiness in companies. That's true, depending on the pipeline. Of course, if you have a strong onco pipeline, you are much more impacted directly. And also the company size, that's for sure. And company impacted next year are in active preparation mode, and they need to prepare, so they do not wait. They need to have a draft report. They need to make their indirect treatment comparisons. They need to plan everything. They need to train the country and to have different scenarios. Having said that, it's important to keep in mind that other companies need to get prepared as well. And so I wanted to come back a little bit on some things related to the work and to explain what does that represent internally in companies. We need to begin working very early on, so probably like 2 years before the EMA submission. So that means that, to come back to my second point, we are working at risk because, of course, unfortunately, some clinical phase 3 are failing. So we need to get prepared, and suddenly everything stopped. It's really a big disappointment of course, for everybody, for the patient. But we experienced that in my company, where we started to work on one asset that potentially could be impacted very soon. And yes, suddenly, unfortunately, we had to stop working. It's never, we always learn from that, but it's a lot of work, it's a lot of investment that we need to put in place for that. And the last point here is also the change in mindset, which takes time internally. That's a change of mindset to explain that we have this new EU stakeholders that may become as important as EMA, so you have different point of view here, but still it's probably a lot of education to come back to this point. We talk about that, about the importance of monitoring that, so we'll all monitor that. The stakeholder will look at the first GCA carefully. We'll have to have KPI, and we need to recognize the benefits. Otherwise, it will not help manufacturer to get prepared, because I think at some point earlier this afternoon we talked about the management, and I think there was something about the employers, the role of the employers. It's true also with company. They need to see the value to put in place the right level of resources. Here, I do not want to list all these recommendations. It's just also to refer to this CIRS report that has been published recently, which comes from a workshop that took place in June. I think it was a good report because it together came different stakeholder, patient association, manufacturer, and also academics and HTA bodies, and they developed a set of recommendations to ensure efficiencies and also effectiveness of the GCA. I think that they are good recommendations, and I encourage you to have a look at this report. So if you look at the long term, I think it's important to keep this long-term vision in place. It's a long transformation journey. I think it was mentioned in the document we received that it's not the end, it's really the start of a long journey. And so, of course, in our industry, we have an operating model that we will adjust. And we have some critical milestones. We talk about this regulation review in 2028 that might come and be discussed in 2027, probably. So it will come very soon, because finally, when you are looking back at the last 3 years in terms of preparation, actually it went very fast, I can tell you. So the next 3 years will go very fast as well. And very quickly we'll have a new drug, such as orphan drug, coming and to be assessed. We also have the implementation of general pharma legislation, and we need to be careful and to monitor that carefully, because there are some potential pain points that may emerge, so it's important to have a close monitoring at that as well. So I would like to share with you a few concluding remarks. I think it was clear that the resources is key. But what I would like to mention is that it's not key only for the success of the EU HTA regulation. It's also key to make sure that there is no delay in other products that are not at scope today in the regulation. We do not want to see any delay for the other product. And I don't think it has been mentioned today, but we will talk about 20. I think we talk about 20 GCA reports next year. But we are talking about much more dossier in the local HTA setting. The second point also is a predictable GSC system. It was mentioned at the beginning, just before, I think, by you, François, about the number of slots, which has been more or less disclosed and which is very, very, very limited. It's a high concern because if you want to get prepared, we know that the GCA will be very important. It has been said also that the parallel consultation probably should be the standard, I think. It cannot be the case as it is today because we need predictability and our clinical timelines are tight. So if you want to plan for next year, we need to have the slot now. And it's already probably even too late, I think. So it's important to keep this predictability in clinical development timeframe in mind. And the last point is important for us as a company is really this Article 4.1 in the EU HTA regulation explicitly states that when developing procedures, the coordination group shall consider the specificity of often OMP, vaccine, and ATMP. From what we have seen so far in the guidelines, it is not explicitly considered, and we do hope that we will have an updated version very soon to take that into account. Thank you for your attention. Happy to take your question.